Hi guys, welcome to the channel. Thank you for joining me and thank you for your continued support. Well, it looks as though Wes Streeting wants more prescriptions for work. Now he's talking about people with anxiety and depression and things like that. He thinks that more work should be prescribed to fix these issues than anything else. Let's look at the article and I'll show you what I mean. Therapists will tell anxious and depressed Britons that work is good for their mental health in a fresh bid to end Britain's sick note culture. Medical professionals are being urged to effectively prescribe having a job as a form of treatment amid concern over the soaring sickness bill. Wes Streeting, the Health Secretary, said the change reflected a shift in attitude to treating employment as being just as vital to health as a diet and exercise. There are more than 2.8 million people of working age who are economically inactive because of long-term sickness, figures have shown. The number has risen by 800,000 since just before the pandemic, fueled largely by a sharp increase in sick notes being issued for mental health problems. As a result, official projections show that the taxpayers' bill for sickness and disability benefits is now set to top $100 billion a year by the end of the decade. Rachel Reeves and Number 10 remain determined to clamp down on the cost of welfare, despite being defeated by Labour's MPs over plans to slash handouts. In a sign of simmering tensions within the party, one Labour MP insisted cuts to welfare are quite simply not acceptable given the wholly unjust way inequality is structured in Britain with so many people living in poverty. New guidance has now been issued to allied health professionals, a group which includes therapists and physiotherapists, on the benefits of work. They have been told to include discussions about employment and its benefits in conversations with patients who could fall onto sickness benefits. They will be expected to ask people what job they do, how it affects their health, and what would help them stay in work rather than leave. For patients who are unemployed, they can ask what job they would like to do, what is stopping them from working, and how that could be overcome. Medical professionals will also be armed with a series of statistics about how going on to sickness benefits can lead to significantly worse outcomes. Official figures show that living in high employment areas is linked to higher risk of cardiovascular disease, mental health issues, and early death. In contrast, people in neighbourhoods with high levels of employment are far more likely to enjoy good health and live to an older age. It is hoped that spelling out the benefits of work and the dangers of quitting will dissuade people from signing on to benefits. So it looks as though they're trying everything they can to try and weave work into everything regarding your medical history and your medical treatment. And, I accept the fact that, if you are able to work, then work can be good for you. I accept that fact that, some people find work very rewarding and actually feel worse when they're not working. But on the flip side to that, there aren't that many jobs out there for everyone who's looking for work. Even if they try to get everyone who could work back into work, there aren't any jobs out there for people to take. That in itself adds more stress, because if you've got people like the GWP on your back about why have you not got a job, and you're trying to find a job but there aren't any, that can also add to anxiety and stress and depression. So I think there's ways that they've got to deal with this which will make it much better than simply saying what work can you do, what work do you want to do. Plus the fact you have to look at the situation of how that anxiety and depression could actually affect your work. Do employees want people who are highly anxious and depressed in their workplace? Now, I understand there are lots of people out there who have anxiety and depression who do work, of course, but what I'm saying is that sometimes that anxiety and depression can actually affect the work that you're doing. And so I think it would be far better to try and treat the anxiety and depression with other methods rather than simply saying go back to work. Because yes, okay, eventually work could be a good thing for them, but in the meantime, how are they supposed to do their job if they're in a highly anxious or severely depressed state? Now, it's a difficult one. I understand that the levels of sickness have gone up since the pandemic. I don't think the whole outcome of the pandemic has been known yet. I mean, the pandemic affected people in ways that we've never seen before, because many people have never been through anything like this before. And I think sometimes the social isolation, losing your job as many people did during COVID, I think that affected people in ways which they just don't or haven't figured out yet. So I think that they need to do more research into why these numbers are going up, rather than simply saying, get a job. You know, there could be reasons behind why these figures have gone up in recent years that could be dealt with, and that would help them people go back to work maybe even quicker than if they were just told they have to go back to work. It's a very tricky situation. There is no easy answer to it, but I'm not entirely sure that telling physios or therapists to ask people about work and what work they can do, I don't see that as an effective part of their treatment. But anyway, that's just my thoughts. Please do let me know down in the comment section what you think. Please do subscribe if you've got this far, and I'll see you next time.